Hello everyone. We are now going to go over a peripheral blood flow cytometry from a 35-year-old man with pancytopenia and numerous bilobed blasts. Let's start with CD45 versus side scatter. We see a small population in the lymphocyte gate, which expresses bright CD45 and low side scatter. Nothing essentially in the monocyte gate. The granulocyte gate has 3% cells that are characterized by high side scatter and dimmer CD45 than lymphocytes. And we see a large population, that is 81% in the blast gate, which is defined by low side scatter and dim CD45. However, here we see that the side scatter is kind of increased, and we see that the side scatter it's kind of merging with the granulocytes here. And if we see what the phenotype this is, we see that they are CD33 bright. They express partial CD34, partial 117. They are negative for HLA-DR. They are negative for CD15. They express partial CD38. They have partial CD13, or more than partial, I would say, negative for 11B. They're negative for 14. They have a dim CD64. They're negative for 16 and 56. They have a dim CD7 expression. They have a partial dim CD2 expression, negative for 4, 8, and negative for 19, 10, and 20. So here we see that they are negative for the B cell markers. They're negative for the T cell markers, except for this partial dim CD7. That's not enough. You usually have a bright CD7 or at least positive CD7 expression in T-ALL lymphoblasts. So this does not look like a T lymphoblast. There is a dim CD2 expression, which is common in this entity. I want you to remember that. We'll see what this is. So we know this is myeloid because this expresses CD33. It has some CD117 and CD13 expression. It does not have the monocytic markers 11B, 14, and it only has a dimmer CD64, and it is also negative for DR. So we know this is myeloid, but what do we call it? So here again, like in the previous chapter, we see that the side scatter is very high, and they have bright CD33, and they're negative for HLA-DR. So these three are pretty consistent in all types of ALL, but there is a variant, APL, acute promyelocytic leukemia, but there is a variant of APL which is called microgranular acute promyelocytic leukemia. So these microgranular variants usually can have some CD34 expression and some CD2 expression. So that's what we're showing here. And the bright CD33, negative HLA-DR, and high side scatter still is the same. They can have partial CD34. So these are a little on the immature side. So they don't have CD34. Their CD13 is partial. They don't have 11B, and they don't have 15. But everything else is pretty similar to what we saw in the previous chapter, because these are promyelocytes which come after the stage of the blast. So they are in the process of losing their 117. They are already negative for HLA-DR, and they're partially positive for CD38. And here we also see a dim expression of CD7. Our CD56 is usually noisy, so we consider this as negative. But otherwise, they are negative for B and T cell markers. So the take-home point here is, again, like acute promyelocytic leukemias, these microgranular variant will have high side scatter, bright CD33, and negative HLA-DR, but they can also have partial CD34 expression and dim CD2 expression. And you cannot call that by flow. You have to say again, acute myeloid leukemia, suspicious for acute promyelocytic leukemia, and alert your clinician and rush your FISH studies. And once the FISH studies arrive, you can put your final diagnosis as acute promyelocytic leukemia. Microgranular variant, usually they have when you see in morphology, you don't see the granules. It's microgranular, so you don't see the granules, but they are there. That's why the side scatter is still high. And also in these cases, the leukocyte count can sometimes be very high. Usually acute promyelocytic leukemias, they present with lower leukocyte count than other leukemias. So it's usually less than 50,000. But microgranular variant can have higher WBC counts. So to summarize, microgranular variant will have slight deviation in phenotype from APLs. They will have a partial, or they can be positive for CD34, and they'll have some expression of CD2. Thank you.